What if light itself could help us age better? Not just our skin, but our energy, sleep, mood, and recovery. Today I'm joined by Trevor Neale to explore how full body light therapy is changing the way we think about women's health in midlife. Welcome to All About You. I'm Dr. Shauna Watts, GP and women's health advocate. Every week, I bring you evidence-based conversations to empower you through midlife. Today, we're joined by Trevor Neale, a pioneer in energy-based devices with more than 30 years of experience developing and training clinics in advanced IPL, LED, and regenerative technologies. He's now leading Zen, a breakthrough in full-body light therapy. Together, we'll explore how light therapy works at a cellular level and why it matters during menopause, the benefits for sleep, mood, energy, skin, and joint health, and how to separate evidence-based technology from marketing hype. Remember, this is general information only, not personal medical advice. Always consult your own healthcare provider for guidance. My guest today is Trevor Neale, an engineer, educator, and industry consultant who has been at the forefront of medical and aesthetic device innovation for more than 3 decades. He's played a key role in the development of IPL and LED technologies in Australia and has trained countless practitioners on how to integrate these treatments safely and effectively into their clinics. Trevor holds multiple qualifications in engineering, radiation safety, and laser and IPL treatments, and is widely recognized for the commitment to making advanced, reliable technologies accessible in clinics of all sizes. Today, as director of Zen, Trevor is pioneering full-body light therapy, an evidence-based, non-invasive approach designed to support energy, sleep, mood, skin health, and overall vitality. His mission is simple: to empower both practitioners and patients with safe, effective tools that improve quality of life through midlife and beyond. Trevor, welcome to the podcast. Thank you for joining me.
My pleasure.
So I'm very excited to talk to you because suddenly my social media feed and my patients are talking more and more about light therapy, and specifically red light therapy or infrared light therapy. And what I would love you to do is break down and tell us, why would we want to do this? Like, why do humans benefit from having light?
Well, it's basically an evolutionary process, and quite frankly, we've got to look at where we derive our energy from. And I can pretty well say most of the energy we get, or pretty well all the energy we get in life is from the sun. If we don't have that energy in place, then we wouldn't exist. The Earth, we would be a dust bowl like plenty of the other planets out there. So we've got to understand that's the case. And I think probably one of the best ways is just to talk about light, what light is as well when we start talking about things like red light therapy. And one of the ways I like to try and explain that to people, it's very much that it is energy. And I think what we've got to realize that we're walking around in this big pool. And I know when we start talking energy, people get a little bit sort of, this is starting to get too technical for me, but understand that we've evolved over the years and we've become attuned to so much that's around us. I mean, even to the point that you can hear me, which is strange. All I'm doing is causing vibrations in my vocal cords, and that's just putting vibrations through the air. Obviously, the higher the vibration, the louder it is, and the lower or the higher pitch it is, the change of frequency then changes all those sort of aspects. So when those vibrations come into our ear, we hear a sound. Now, light's exactly the same. The cones on the back of our eye at much higher frequencies are seeing all this energy that's bouncing off things, and it comes in, and we interpret those different frequencies as different colors. I mean, obviously, if we turn the lights off and turn the sun off, it's just black. So if we don't have that energy around us, then we don't see things. So look, in that case, we've got to understand that pool of energy that we're in is actually charging us up as much as it gives energy to plants, as much as people realize that it's going into your solar panels. And it's charging up your batteries on your phone or running your fridge or all those things in those areas. It's doing exactly the same for us. So I wanted to highlight that's the process.
So my understanding is that this red light that
Yep.
we'll talk in a minute about why we're interested in red rather than the other colors at the moment. But so this red light is kind of going into our mitochondria in our cells,
Yep.
which are a little bit like our batteries, rechargeable batteries, and it's sort of charging up the batteries. So a bit like whenever your phone gets a little bit old and the battery's not charging up so well, pop yourself under red light LED therapy and you're going to charge your battery up. Is that a really basic way of
It's a
understanding?
great analogy. I mean, I also relate to things like a rainy day, like, it may be in certain times of the year compared to a sunny day. On a sunny day, people want to get out and do things because they feel like they've got energy and want to do things, compared to rainy days where it's, time to curl up on the couch and do a Netflix binge or anything like that. So, it's relating to that. So that's a great way to sort of put it, but 100% correct. Well, there's more to it than that. Not only are we taking that energy or that oscillating energy that comes in and it's reacting with our mitochondria, it's actually enhancing the process of dealing with the glucose, if you like, the oxygen that's coming in, and it's assisting the process of building that chemical energy that our cells need. In this case, most people know it as ATP or adenosine triphosphate. So it's enhancing that particular process to do that. And at the same time, to really deliver much more effect on this, it's actually increasing the nitric oxide in the blood. In summary on that one, and you'll probably be able to do this, and if I'm not on the right track, let me know, but ultimately it's increasing the blood's capacity to carry oxygen, and then it's also increasing the capacity for that to transfer across to the cells. So we're getting that increase of oxygen. We're getting a release of some of the triglycerides and free fatty acids out of our adipose or our fat cells. So now we've got more things to feed to our cells. We just need more energy in the cell to produce that ATP. These three things work together. So that's sort of like food, air, and light. So we're a little bit like plants in some regards. I mean, if you look at photosynthesis, and just going off onto that subject, and I talk about this quite often, photosynthesis, it's just huge. I mean, no one takes 3 meals a day into a plant or into a forest. They've got to get their energy from somewhere. And think about what 1/10 of the Earth's surface is doing. It's producing all the oxygen that we breathe, and we need that for energy. So, indirectly, oxygen is coming from a process from the light from the sun. It's then using that and converting it to NADPH, which, we produce NADH for our body. And also, again, it produces a chemical called adenosine triphosphate, ATP. So our respiratory process is very similar in these sort of things. So beyond that, it stores the surpluses in glucose and starches. We'll call it apples, oranges, potatoes, all these different fruits and vegetables. Animals eat those. We get fats, proteins. So pretty well all the energy that we have originates in the form of light. And much like plants, we have photoreceptors in the body that allow us to absorb that energy. So it's part of our normal, what we should be getting on a daily basis, much like the food.
So I'm just going to pause you there to make sure that we're all understanding. So everyone needs to think back to their school biology lessons and whenever they were learning about photosynthesis. So that's when the sun's energy is captured by plants, leaves, trees, and that's how they grow, basically. And so what you're saying is that in ways this is a similar process. So we're using this light to give our cells more energy and basically improve cellular function. Is that?
Well, it's not only improving cellular function, yes, because we're increasing that chemical energy. But I mean, the Matrix trilogy, I'm not too sure about mentioning too many other franchises out there, but as an example, if you've ever seen the Matrix and the fact that it was all about humans being batteries, the fact that from my brain to my hand, it's an electrical signal. And we're now talking, and I've talked about energy. And if you think about an electric network, we've got this oscillating energy passing over the heme, which is the iron in our blood, as well as over copper. As an engineer background, which I come from, that's a generator. We're generating and we're increasing the bioelectronics in the body as well, which not only is assisting the brain in terms of that functionality, but also assisting there's as you would know, there's a membrane potential around our cell. It then assists those cells then to draw in the nutrients they need and dispose of the wastes that in terms of like a healing process to sort of increase its capacity to do that. It also assists within the cellular communication. And then we start talking about neurological disorders, whether it's Parkinson's or motor neurone disease. I mean, there are clinical studies in place with this, that it's increasing that signal pathway so there's greater capacity for that signal not to be corrupted so that they have greater control. So there's more than just, and this is where I get very excited about it, of course, there's more than just that cellular energy and cellular performance and all the things that come with it. I'm sure you could sort of highlight what the benefits of those will be. But there's more than that. It's bioelectronics, there's endorphin release, there's so many things. I mean, you go out in the sun and you know how you feel, you're drawn to it. If it's and I hate to say, if you're in Australia and in Melbourne, winters are cold and wet, the beginning of spring, the best thing that we want to do, we're drawn out in the sunshine and we just look up at the sky and go, oh my God, this is amazing. We're just drawn to that.
What I want to understand is we spend a lot of time telling people to stay out of the sun.
Mm-hmm.
And we know in Australia, gone are the days where people can go and lie on a sunbed, an electric, and have fake tan done by a sunbed or whatever. I think they might still have them in the UK. So why is this specific form of light? Why are we interested in this red light?
All of the frequencies in whether we want to call it visible light or infrared light, we're in that pool of energy, and they all have different reactions. I mean, when we talk about being out in the sun, we're talking about UV. The issue with UV, obviously, the benefit obviously is a vitamin D production, but overexposure, you have the potential melanoma, all those sort of things occurring. So we need to minimize that. And I would say sort of in Australia, for example, a lot of us are out of our skin type zone. So, our biggest problem now is if we want to get those other specific frequencies and absorbing into our body, then what if we're trying to do that with UV to get if we're trying to do that with red, for example, then we would overdose with UV. So it's going to be very difficult. So UV has a particular place, obviously. Red light, and the great example I give most people is just turn a torch on, like your little light on your phone. White light's a combination of all wavelengths traveling through space so quickly that when it gets to your eye, you sort of see it as white. It's reds, greens, and yellows. Put your thumb over that, and then you'll sort of say, which is the uninvisible color passing through tissue? And the answer is going to be red, okay? So, and that comes down to why is blood red? It could have been green, black, white, clear. But that allows the light to bounce off to go deeper. It blocks our greens and yellows. And all of this comes again from an evolutionary process, because when we get up in the morning, our brain's a little bit disconnected. We're paralyzed as we're in our deep sleep. Our brain's a bit foggy and all this sort of thing. When we get up, we've got to get ready to fight or flight. So it's more red near infrareds to push that ATP into our muscles, to increase the oxygen to the brain. And then once we get closer to the midday sun, it's really the greens and yellows are focusing on epidermal. So the blood's stopping it very superficially so they can deal with that midday trauma. All of it has a place, but specifically with LED or this process of converting it to a chemical process, we are trying to get deeper into tissue, because generally for more your epidermal work, you can use more your bespoke topicals that will penetrate, and clients can obviously take those and apply them at will, whereas having to pop in and have an LED treatment for those other areas is not as vital today, and they tend to cover up with sunscreen anyway.
You know my clinic, and the patients I'm very interested in, sort of usually middle-aged women, postmenopausal women. They're often not sleeping. They are fatigued. They feel like they've got no energy. Their brain feels foggy. Their thinking just doesn't, the thoughts don't seem to be coming as easily as they previously did. Where does red light therapy fit for those type of patients?
Well, for me, even I'm not to say that I'm anywhere near that, but I mean, as we age, obviously as well, our capacity to process information as quick or keep up with younger people, and again, not sort of taking away from that, but I find just as a personal experience as a male, that going into and having a red light treatment, with that increase of oxygen, that's giving a lot more oxygen feed to the brain, which then sort of assists with greater clarity of thought and focus. So even in putting it across there to that particular level to sort of go, okay, that increased oxygen is going to assist in that particular process. Obviously, if we're then looking at bioelectronics and increasing the capacity for those signals to respond and the whole brain functionality, then we would see that being a part of it. if we're also putting greater ATP into the body. I mean, we're not just talking about cellular function. That's the ATP is what the muscle burns as an energy, as you know. And if we're priming the body up with that, it just gives you physically more energy. So if you're dragging the chain or your brain feels a little bit foggy, it's just giving you that boost to sort of go, okay, let's get on with it and get into it. So it is a whole process of another way to put that energy in.
One of the things that I've found in the clinic is not only does it help people feel like they've got more energy, and we've even had patients who've come in and had it after surgical procedures and things to try and help them with their recovery. But we've also noticed that not only do you have more energy, but kind of inversely, you're able to sleep better,
Yes.
which I found really interesting. Do we understand why on earth
Yeah.
that works? It
I'm gonna
makes sense.
on that one. I really, it's something I get as a feedback from so many different people that everyone seems to get a story associated with it. Whether it's for me, I find I'm way more productive in a day if well, let's not sort of put everyone to early morning. If I have it sort of in the morning sort of process, so I'm way more productive. I have people coming back sort of talking about, when they go to gym, normally they sort of suffer from DOMS or delayed onset of muscle soreness or that pain after their workout, which they say, well, after a red light, I don't seem to have that struggle. On a sleep side, we get that feedback quite a lot. I actually don't know really where that comes from. I don't know. I haven't sort of looked at studies, and I'm not too sure whether they've done massive studies on the benefits of red light therapy in sleep, but everyone seems to get a bit of a story, whether it's a performance sort of thing. For me, again, it's about my productivity in a day. For other people, it's about how they recover after sports, or they wake up with a sore shoulder or a sore back, and they're finding that doesn't seem to be so much of an issue. And a lot of people, the first thing they tend to notice, and I will sort of say, they don't tend to click on the first one or two treatments. They just seem to have a good night's sleep and they go, oh, that was a good night. But after a while, they start to realize it all links in, that that's what's going on. But as to why that seems to be such a big one that people pick up, it's very obvious. But outside that, I can't sort of really indicate on the therapeutic side.
So I know that you like to nerd out on all the science, Trevor, and obviously we like to have things in our clinic that are evidence-based.
Yep.
So there seems to be absolutely copious amounts of studies appearing on the benefits of red light therapy, and there's clearly been people who have been working behind the scenes probably for decades in this arena.
Centuries.
Yeah, absolutely. So where are we in terms of evidence base for the types of units that we're seeing starting to pop up around the place?
One of the things, whether we want to call it low-level laser, which was something that came historically, and that's just a historical thing in the involvement of things like LED, the only way we can get the intensities without generating the heat. So back in the day, it was low-level laser or cold therapy. Once LED started to getting more and more efficient, we started to get into arrays and all of that. There's PubMed, and you're very familiar with PubMed being in that medical space where you review all your documentation and get all your clinical studies. At the moment, we can pull around about, it's between 6,000 and 7,000 peer-reviewed papers associated with photobiomodulation and the effects of photobiomodulation. I will sort of indicate, even if you think about simple things like seasonal affective disorder, so you can relate it straight away, there's probably about 2,000 or 3,000 of those are on neurological disorders and things like that. But that sort of resource base really feeds into a greater understanding as to why, we're seeing the uptake and why, it is delivering the outcomes that we've been talking about. And that's the referral reference base that we tend to go back to. It's, again, a reference base that I'm sure in a medical space that you would go and source a lot of your data as well.
Yeah, absolutely. And so what you're saying is that not only would it seem that there is a space for this in the wellness space, which is clearly where it's kind of exploding right now, but also with regards to neurological conditions as well.
Absolutely. Yeah.
So, and that's maybe where a lot of the data has originally come
Well,
from.
part of it. I think they're looking at it in supporting so many other ailments. And I know there's even studies at the moment on retinal work as well and repairing the retina. So not that we would use that in this uncontrolled environment and have people do that, but it's just highlighting that through all sort of medical specialties that they are identifying that there is a whole regenerative type or preventative type of process going on with red light.
I have to admit, whenever I first came into aesthetics, I was and remain sometimes a bit of a skeptic about things, or a cynic. And I remember thinking, how on earth would this light help someone's skin? And yet I'm always absolutely blown away by the results that we get with patients, sometimes by just getting perhaps this correct skincare for that person and using, a facial clinical grade sort of um, LED on the person. Can you explain to me what LED light is doing? Because you see them in clinics everywhere.
Yep.
We'll pop you onto the LED. What are we doing with that?
Look, normally when we sort of go through the process of understanding it, it's just sort of saying at the end of the day, we're increasing the cellular energy, and it doesn't matter. It comes down to what that cell's function is. If we can make that cell stronger, it's much like you. If you've got more energy, you'll get more done. So if the cells are stronger, whether they're in trauma or whatever, they can repair quicker. If we're talking collagen, it'll make that stronger as well. It's all, and in some regards, I almost go back to you on your medical side and sort of say, okay, if my cells are stronger, it's almost what am I? I'm in my 60s, basically. If my cells were like I was a 20-year-old, what would be the difference in process? And we'd expect that I'd heal quicker, you'd have a better outcome, and all those sort of things come into play. But it's really about increasing that cellular energy so that they can do their functions better.
Ladies, are you feeling flat, foggy, or like you've lost touch with who you used to be? Well, it's time to rediscover you. After 25 plus years as a doctor working with women as a GP, an aesthetic doctor, and in women's health, I've created the 16-week Rediscover You program to help you reclaim your energy, confidence, and vitality. This guided, evidence-based journey is specifically designed to support you through the perimenopause and menopause. Together, we'll reset your hormones, boost your energy levels, create sustainable weight management, and restore the clarity and glow you deserve. We'll take a deep dive into what's really happening inside your body, from hormonal shifts and skin changes to disrupted sleep patterns and mood swings. You'll get the tools and understanding to navigate the powerful transition with confidence, clarity, and care, because you deserve to feel like you again. Our waitlist is now open. Click the link in the show notes to save your place. One of the reasons I think people do also really like LED is that it's relaxing.
Yep.
It doesn't hurt. There's usually a bit of a warmth to it. And obviously, as you say, something about being bathed in light definitely makes us feel better. So it's kind of nearly like one of those treatments, for want of a better word, that is kind of a low entry in terms of people don't need to be scared of needles, or we're not having to do anything invasive to them. They literally can come in, and whether it's just for treating their face or their neck, or whether they're under a whole body unit, it's basically just pretty much take your clothes off and hop under and relax for 15
laying
to
on the
20 minutes.
beach almost, yes.
Yeah, absolutely. And so what is do we know what the correct protocol is? Like, can you have it once in a blue moon, and does that help, or do you need to have it regularly? Like, do we know that?
Well, look, I often relate red light or light, actually, in terms of there's ways that we get our energy. Obviously, one is through food, and I talked about photosynthesis earlier and the fact that it originates in light. But we also get that energy through our body into photoreceptors in our body as well. So we are expected to have a certain dosage of that. And our whole skin typing that we have, whether you're on the equator or further than the equator, is about managing and controlling how much of a dosage we get if we were running around naked, which we obviously don't do these days, and we're out hunting and gathering. So that whole thing evolved from there. So there is meant to be a specific dosage of energy that our body absorbs during the day, as well as obviously that we eat. I mean, even if we look at food, if we're looking at, say, on a female side, it's 1,800 calories. I think, what's that, about 8,800 kilojoules? But kilojoules is a measure of energy, and we use that when we're talking about doses of light as well. So not only are we meant to have a certain amount of
food
energy,
yeah.
And if we underdo, we don't do much of that. And I sort of make this analogy that if I sort of you went to half calories for the next couple of months, sure, you'll be thin, but you'll also be very weak and fatigued and all these other sort of things that will happen with it. It's the same thing with light. We are meant to have a certain dose. So the answer to your question is yes. There is a certain dosage we're meant to have. There is a plateau level, so it makes it quite easy that there is a certain deviation that we can have in that plateau space, and of course we need to consider that we may be working with different skin types as well, which is more of an operational side. But ideally in that particular case, we do need to deliver a certain dosage, and that sort of information is there. I will say with what we do in our devices that we run, we do tend to treat ideally for a full dose through that. And when you do get a full dose, we sort of go, well, you don't go and get a full dose. You don't have a meal now and then 5 minutes later and do another meal. You'll overdose. So again, there's this fine point where you need to sit for that maximum level. And I think even when we look at things like the face masks that are out there, and I'm talking about someone that's not getting that light exposure that they would like or whatever, we can almost treat that as a bit of a snack, a nibble. If you're starving to death, someone gives you a snack, you're going to take it. It's going to have some benefit, but it's certainly not going to deliver the same level of energy that you would sort of see more on the bigger space that we're working in, not only in the beds, but in the array base that we do in more of a clinical environment.
So what I want to just summarize, what I'm understanding what you're saying is, and I've never thought of this, I have to admit. So we need energy in the form of kilojoules of food to keep us going, but actually we're supposed to have also got kilojoules of light on our body. And if we look at historically, for all the millennia that we ran around half naked or nearly all naked,
Yep.
we were getting certain amounts of light all the time. But if we look at in the last, 200 years or 100 years, we're inside fully clothed, often not getting our light exposure. So what we're trying to do with light photobiomodulation is that we're trying to give our bodies back a dose of light that perhaps we're not getting. Is that kind of it?
100. Look, it's part of our respiratory process. Sorry, but it is part of that essential requirement. I mean, if you put a plant inside in a dark room, you can give it all the nutrients you like. It needs light to survive, and we're the same. We need that. I mean, I think seasonal affective disorder is one of those things that, if you're familiar with that, short daytime durations in Alaska where you start getting anxiety and depression, it's all part and parcel of understanding how this all comes in.
Doesn't even have to be in Alaska. I know there's definitely people who even have it in the winter here.
Yeah.
They get very depressed, very sad. They lack motivation. They feel sad. They've got all the hallmarks of being depressed, and it probably is through absolute lack of light. This is so interesting. Okay, so I want to ask you a little bit about what is the difference between sitting in an infrared sauna
Yep.
and what that's doing versus lying under or standing in a LED device.
Yeah. So it's almost in the name, and I hate to go and add a technical aspect to this and sort of say Albert Einstein. One of the theories that he's got, that we cannot create or destroy energy, we can only convert it from one form to another. So knowing that, and we think that this energy has to do something, when it absorbs into something, whether it's me or the floor or anything, it has to have a reaction. Now, either it comes back out as light or it's got to convert to heat. So in many regards, light does convert to heat. We know, obviously, on the Earth's surface, on a sunny day, it's great. It needs to convert to, we can convert it to electricity. I mean, that's what everyone's paying all those big bucks for. And obviously it's great because we can bring that in and just put solar panels up. And as a result, it's converting to electricity. And it converts to a chemical. I mean, even if we look at photosynthesis and at the production of oxygen and plant-based ATP, we're seeing the same sort of thing going on in the body. So there's two ways that energy can react. In it's a near more of a far infrared when we start getting into a sauna, and understanding that it's in the name. Sauna basically means when that light absorbs into tissue, it converts to heat. So if you're in an infrared sauna, typically it's not the sauna that's the hot box like you get with a steam room. It's actually the body that's heating up through absorbing that light. So it's converting to heat, and as a result, we have the therapeutic aspects associated with heat therapy. And again, I'll probably throw back to you and sort of say, well, what do you sort of see as the benefits on a medical space? Whereas when we start talking LED, those particular energy frequencies are different. It's not like UV where it's starting to produce vitamin D. And it's, up in that UV, we start getting, an increase of melanin and things like that as well. It's further down the spectrum. And in this particular case, it actually it converts to a chemical. And that chemical, as we've already sort of discussed, is adenosine triphosphate, ATP, and also there is a nitric oxide increase as well. So one converts to heat, the other converts to a chemical. So
Right. Okay.
that's pretty well more simplistic in that longer summary, but that's it.
And if you had a choice, which one would you
Well, in
have?
some regards, you could almost say that both have their advantages. For me personally, obviously, I'm in this space because I'm passionate about it, and obviously, I want energy. And there are other therapeutic aspects associated with heat, and it's not really giving your body energy, but it's giving certain areas that capacity to do whatever heat does for it. But yeah, for me, I'd certainly prefer to get that energy to sort of get the brain functioning and the body going.
Yeah. Okay. Awesome. And so if you were thinking about embarking on a course of LED light therapy for your whole body, whether you're going to go and stand in a machine or lie down or whatever you're going to do, do you go twice a week or once a week, or do you do it 8 times and then take a break, or do we know?
Well, look, it's the thing here is that it's if I go back to that food analogy, I mean, do
Oh,
you
but you
eat
don't eat.
once a day or do you sort of continue to eat every other day? The answer to your question is that you need to have this light exposure continually, And I go back to the point, well, yes, you can go outside naked in your backyard. I don't know whether, maybe where you're located, it may be a good
Not
or
with the
bad
brain
thing.
today, no.
Not today. But ultimately, it's going to be something that you will need to sort of look at as some way to get that, whether you do get out on early morning walks, for example, which will help. There's no doubt about it. But certainly, I think we normally recommend a series of around about 6 to sort of get that capacity up, and usually about twice a week. If you are doing something, we do have protocols for daily, but we really cut your dosage down quite a bit. But normally we prefer to do twice a week type of protocol, and you do that over around about 3 to 4 weeks. From there, I think most people start to understand what it really is doing for them. Doing it once, it's not really going to give you a bit of because whatever happens, you sort of go, well, maybe not. And then from there, it's just a case of really you just need to look at doing some top-ups now and again to pop in, whether that's one a week or something like that. So,
And safe to do long term. You can do it
well, it's like food again.
Yeah.
We come back to that aspect that you are out in this, you're in this energy anyway during the day. We're not using, this is not UV or whatever and I don't even think with UV, whether there'd be a massive cumulative thing. If you do get exposures every day, you should probably have exposures of that as an ongoing thing as well. But yeah, it's something that unfortunately that we need to get out there, and it's a perfect area where you are here up on the Central Coast as well for people during summer, but during winter, probably a great add-on to get you up and going.
And why do we have to wear goggles?
Well, look, we are really putting energy in at quite an intense level. The only real risk that we have with all this, obviously, is eye sensitivity. So we either have goggles, we do have other safety glasses that you can wear. You got to understand that obviously the lens, and you understand, of course, but I'll just highlighting, but at the lens of an eye is going to focus by a factor of about 10,000 onto the retina. And if you're not going to stand on a hot sunny day staring at the sun, because all that prolonged exposure is going to that will be a cumulative effect for potential glaucoma or something that long term. So the goggles and all that are to mitigate and ensure that we're not getting that high exposure to the retina.
Right. Okay. And what is the benefit in terms of anti-aging for the skin?
Well, I mean, again, it comes back to, and I
Same
throw
thing.
back to you. I mean, it's as we've said, if the cells function, if they're stronger because they've got more energy, they're able to function better. That goes into everything. Again, coming back to collagen, all those sort of aspects, but healing, elasticity, all of those. I mean, you're probably in a better spot to be the authority on that in terms of increasing energy in those. And
Yeah, I think just in really simple terms, if you've got a cell that's, as we age, what we know in simple terms is the cells do not function as well. They basically get kind of lazy. There's got mistakes in various messages that are being sent from the cells. And if you can actually fix those mistakes and get it to behave more like a young cell, then, clearly things like appearance or cellular function is going to be better.
oh,
I think
feel
that's it.
better too. I mean, we haven't talked about the endorphin release. I
Yeah.
mean, funny, when I mentioned before about laying on a beach or whatever, you close your eyes on a beach and you just, you feel good. I mean, there is an endorphin release with this too. So, you get that in the treatment as
Yeah.
well. So, that's just uplifting in itself. I think sometimes it's good just to sort of escape in there and
Yeah,
just sort
absolutely.
of do a bit of, emotional recovery as well as physical.
100%. I think that's one of the reasons why we've loved it in clinic is people just coming in and actually taking sort of 15 to 20 minutes out of their day and they just chill. And, our patients do tend to, they've got their goggles on and they're just relaxing, listening to music. They're not scrolling on their phone and they're just having, a bit of a break from
Yeah.
the world, which I think in itself is also therapeutic. Trevor, is there anyone who should not have LED light therapy?
The only area that we're really, I mean, if you're have a major light sensitivity, I mean, again, you've got the experience even with the lasers and all the other light-based devices that you work with, which is highlighting the potential energy that is in light, that you can do
Focus
things
it.
that,
Yeah.
you can focus that down and have more of a heating effect, and whether it's excisions or just coagulation or whatever. But and we know people that have had that are very sensitive to light. It can be a bit of an issue, or can be an issue in that particular space. We do get concerned. It's more about the eyes. So if there's whether there's a degenerative eye disease such as ocular albinism or something like that. We do get concerned more with things like near infrared as being a thing that may sort of cause a little, may exacerbate that particular process of degeneration of the eyes. But again, that's why you're wearing eye shields and glasses. But ideally, we sort of tend to avoid treating clients at that particular level, and that goes into the consultation and questionnaires that come through anyway.
Yeah, absolutely.
But yeah, outside that, there's not a great deal.
Not
No.
many things. And I know that you have a number of very high profile sports clubs and that are all engaging in this therapy. So I have a few questions that I want to ask around that. Are they putting their athletes, so they're football players or rugby players, or are they putting them under the light before training or after? That's my
Normally,
first
at the
question.
moment, they're using it for what we call photo recovery instead of photo preparation. I mean, we do talk to them about doing a bit. It's like a day. You get up in the morning, you have the red near infrared at the beginning of the day and the end of the day. So it's photo preparation, photo recovery. In those particular environments, they tend to use it more for recovery as opposed to prep work. And that just comes down to who's got, if they're allocating the time to one of the athletes, who's the higher priority to be able to get them in there and give them the space and time to get them in there, sort of thing.
And so basically, again, it's back to those basic principles. We're using it for athletes because we're wanting their cells. We want to literally at a cellular level give them every opportunity to have the best performance, to run the fastest, score the goal, whatever we need them to do. So basically, we're literally trying to make sure that every individual cell is functioning at the
Fine.
optimal level.
Yeah, absolutely.
We're thinking about their nutrition. They've got all these nutrition coaches, dietitians working out exactly what they're eating. And now what we're doing is we're also reflecting and making sure that they've got the correct light. Is that basically?
That's it. I mean, if you're putting energy into a muscle, you're increasing that ATP. And if you've got that, not only you've got the increase in functionality of producing ATP, so recovery is quicker, you have greater ATP reserves to draw on before you have to start going into your anaerobic type of of performance. So it's giving that edge. And I hate to say it, there's no way to test for all of that. It's a natural process. So it's becoming quite common in terms of pre-prime. Some athletes would, in that case, especially in a marathon or something, may pre-prime a little bit before they go out on the run, in order to have that little bit of extra energy and drive during the event.
Excellent. And you also touched earlier a little bit on DOMS, which is delayed onset muscle soreness after exercise. We've all had that, where we've gone too hard and then going up the stairs a couple of days later nearly kills you.
Yeah.
And so again, this would be something that you would do straight after exercise or the next day?
Well, anytime. I mean, even
Anytime
if
you can access it?
The only thing is, there were some study. I know of one study that they did where they did a LED prior to the just weights and things, and they found that they could actually lift sort of heavier weights and had greater endurance. If you're going to push harder, then great, you'll get greater workout, and then of course, then there's still a possibility that you'll still have a little bit of that DOMS coming through. But post exercise, then immediately, or when you're getting it, come in and have it whenever you can sort of get in. Really, anytime would assist. Yes.
I love that, because I'm trying to convince all my perimenopausal and postmenopausal women that they have to start doing strength training and heavy lifting and muscle things. So we can do it pre or post, which is very interesting. Is there one myth about light therapy that you would like to bust?
One myth. I'm trying to. Wow.
Well, I might jump in while you're thinking and say, for me, the myth would be that it's woo, like it's just made up, that it's pseudoscience, and that how could a light be making a difference? And I have to admit, honestly, I was a little bit skeptical. Probably 7 or 8 years ago, I was kind of like, what on earth could this really do? But I have to say, it's one of my favorite things to use in the clinic. So I've definitely been won over both. It's all very well reading things in medical journals, but translating them into day-to-day clinical practice and seeing a result is a different thing, and I definitely do. But is there anything that you think people believe about light therapy that's wrong?
Well, look, I think just on what you said, historically, it was a big thing, where people were very skeptical. I mean, I was skeptical back years ago as well. I mean, I come from a laser background as well, where we're doing sort of more instantaneous, big focus outcomes for clients. So I was skeptical in that as well. But really, what's really turned us all around and gets us very excited, especially when I start going through all the research in terms of just nature. I mean, even the discovery when I go through photosynthesis, realizing that the chemical energy they use is exactly the same as what we use. And then I look at, they're green leaves, so they're obviously reflecting green and absorbing red. So red's a big wavelength for plants as well. All of these sort of come into play that you sort of go, well, there's something very solid with this. I mean, you sort of talked about this has been research going on for years. I mean, if we go back to 1900, not 1900s, but 1900, but way back, they used to have light therapy up in the Alps in Switzerland, where people would go up and they'd just sort of do recovery up in those spaces. And it was, so we know, and even the worshipping of the sun, it was a real healing space. So this sort of understanding has been around for many years. And I think more recently, the reason why I didn't sort of grab onto that as one of those myths is because I sort of hear the, I'm saying energy, but the enthusiasm of the users, because they're, people who are supplying, like you are, providing a service to clients, and their feedback and the speed of recovery for clients compared to what they've seen previously, and the overall outcomes, and just the benefits they're providing, that's creating an environment now where this is becoming more and more and more accepted. So I probably didn't think of that as a space, because most of the time around me, I'm finding people are very, very positive. And I think we're becoming more and more aware of the benefits and understanding how important this is.
What I think, just to finish it, I think is really interesting is if you look at old hospitals. So like one of the old hospitals I worked in Belfast, Nearly all the wards had a balcony at
Yep.
the end of them, with big sort of sliding doors. And bearing in mind, Northern Ireland, it's not terribly hot or sunny. But it feels like all those years ago, they knew there was a therapeutic benefit to patients who were sick, being wheeled outside, even having beds pushed outside. And it's kind of like, in a way, we've forgotten. And if you look at modern hospitals, they usually have safety glass and there's windows that don't open at all. Like, there's often virtually no fresh air. There's certainly no way that an unwell patient can go outside, and usually staff are way too busy to take them outside. So you can have someone who is literally inside for days, weeks, months. And I just have to wonder if we didn't step back and maybe become a little bit more old-fashioned and remember some of the things that we knew. I mean, if you even think back to whenever people had TB hospitals and things, like, they always had them outside, sitting out in the fresh air, or even some of the Scandinavian countries where they have their babies outside every day to sleep. So it's like we've kind of forgotten some of the really basic principles, and it's coming full circle.
Yeah. No, I totally agree on that side of it. It's really, and I think that's really does energize us, sort of looking back and realizing that this is not new. And as I said, sun worshippers and the sun gods, all this. And I know it's sort of a little bit out there, and it's not medical science in that regard, but you can sort of see that there was a massive understanding of how important that was to us in the past. The fact that even now, we're all excited. Where do we go on holidays to recover and all this sort of things? Well, some of us go skiing, not me, by the way, but some people go skiing, but a lot of us end up on the coast somewhere on a sunny beach and just enjoying that energy, that we can feel it on our body. So I think it is that the realization that that's where we're heading back to.
So basically, in summary, photobiomodulation really is a safe way to expose your body to light and top up your energy levels.
Absolutely, yeah.
Thank you so much.
My pleasure.
Here are my 3 takeaways from today's conversation with Trevor Neale. Full body light therapy works at a cellular level, boosting energy production and supporting recovery in ways that can make a real difference during menopause. The benefits are broad: better sleep, improved mood, healthier skin, and reduced joint or muscle discomfort, making it a versatile tool for midlife health. Not all devices are created equal. Choosing safe, evidence-based technology ensures women get results without falling for overhyped promises. Thank you for listening to All About You. If you found this conversation valuable, please follow the show, share it with a friend, and check the show notes for more on Trevor and Zen. Until next time, I'm Dr. Shauna Watts, reminding you that informed health decisions start with you.